we have with us the man of the moment, Dr. Amadou Sall. Congratulations, by the way, on the conferment of your award. How are you feeling, really? That's the question I want to ask.
Oh, thank you very much for the congratulations. I feel really, really good and grateful to ADN. Yesterday when I received the awards, I just mentioned that innovation has been why I got hired when I was younger, bringing innovation to Africa. And 30 years now from I'm being awarded because actually people believe the innovation we've done has made a difference. So it's more like having the full circle. So I am very, very excited about that at the personal level, but also very excited because Silicon Valley in the world is probably the center of innovation. So having ADN recognized is great for me.
Thank you so much. And in the midst of all of this excitement, part of the reason you've been awarded is, of course, for your successes. But I know that behind all the successes are, of course, also challenges. Can you share with us some of the challenges that you're experiencing in your work? And what do you think needs to happen in order for those challenges to be overcome?
Yeah, in terms of challenges, I would pick three important challenges. One of the first challenges you can face when you work in Africa and you have big dreams is the credibility and the support you should receive. People believe if you say that I'm going to be building a factory within 6 months to make diagnostics high-tech, people have tough time believing it. So this is a serious challenge because it's implied fundraising is complicated, workforce is complicated, making it happen is complicated. And those challenges, the way to tackle it is really to build success stories. So celebrating what we have been doing for COVID, bringing $1 tests, among the first in the world, bringing vaccine and vaccination happening in the coming years by building new factories, showing that innovation can make a difference is how you build and change the narrative. The second major challenge also you can face in Africa is the workforce. What we're doing implies very highly qualified people. And this implies also you have to incentivize those people to come and work in Africa, while because they're skilled, they have as opportunities. So this is a very big challenge, having the right people. And once again, by coming to ADN, many of the people I hired now come from the diaspora. So the diaspora is for me a good connection, how to fix also that challenge. And the last important thing for me in terms of challenges, bringing people to think for the African population. What it means is that in Africa, the communities are important if you want to be impactful. And in this regards, most of the innovation that people design are not necessarily targeting those populations. So the way we reverse that is we change our approach because we know very, very well Africa. And we have this approach where we're doing co-creation rather than imposing. We listen to communities rather than lecturing them. And we work with them to come to a solutions. And that part is what helps us actually build some of this good success. So the challenge about listening, because we are not trained necessarily to do that, we believe that we know everything. So, and we have to learn a lot from them.
Thank you so much. And lastly, I want to ask you, the theme of this event is Future Ready Africa. When I think about the future, I think about Africa's youth. And, we've heard that the numbers is expected to double Africa's population over the next couple of years. What is your plan to harness the talent that's on the continent, particularly Africa's youth? Do you have a framework to sort of tap into that talent?
Yeah, clearly one of the greatest opportunity we have with young people is they're very creative. And I've been impressed where I go in Africa by the creativity. So what we've done is we build up a whole pipeline for innovation. Today we have put together what we call Grand Challenge Senegal, which is a lot about helping an idea to turn to a prototype. So we give this seed money to help having feasibility study and prototype. On the second bricks of the pipeline They built a venture studio, so people that would come as a prototype, as the first mechanism may allow, would have an opportunity to build a startup, to build a company, to get started. And the third break would be our institution, like Institut Pasteur de Dakar, would help them implement those technologies. So this is an innovation pipeline that is really focused on helping diagnostic, vaccine, therapeutic, vector control, really focusing on what makes Africa resilient to epidemics, because that's what we do, supporting the health system, making sure that they can deliver the service or have the tool they need for people to be in a better health. And by building this pipeline for innovation, we give huge opportunities and